Well, good afternoon and welcome to our January Ranching 101 webinar presented by AgTrust. Today, you will hear from an industry expert and learn essential strategies for maintaining herd health. Before we start, please join me in a short message from AgTrust.
When your passion is agriculture and a rural way of life, you need a partner who understands. That partner is AgTrust Farm Credit, formed from two trusted farm credit associations. Our mission is to provide personalized financing tailored for full and part-time farmers, ranchers, agribusinesses, and rural homeowners. And because we live in the communities we serve, AgTrust Farm Credit is here to help you succeed.
Well, at this time, I'd like to introduce our guest speaker. Drawing from her extensive experience and commitment to educating others, Dr. Brittany Berry will guide attendees through the key strategies to optimize herd health, drawing from practical, science-backed advice on maintaining the well-being of the cattle herd. Berry was born and raised in Allen and received her Doctor of Veterinary Medicine at Texas A&M University in 2017 and started working at Salt Creek Veterinarian Hospital. Berry has a passion for educating and retaining the next generation of rural practitioners. Berry serves on AABP's Student Activities and Membership Committee and the Texas VMA's Bovine Practice Committee. If you have any questions during the webinar, please submit them in the chat box. And at this time, I'd like to turn it over to Dr. Berry.
Good afternoon, everybody. Let me get my presentation pulled up for y'all. Okay, so today we wanted to talk about optimizing your herd health plan for starting in 2025 and hoping to start this year off on the right foot. We're going to talk about some basic principles to increase production efficiency. I am a mixed animal practitioner in kind of like north, central, kind of west Texas. We're 6 different practices that are in the gap between Fort Worth, Abilene, and Wichita Falls. All that open space in there, we have a bunch of different practices in that area. So we all work in small towns and see a little bit of everything, but kind of my passion is production medicine and helping people make decisions that are best for them in each individual scenario for their herd, because it's not always the same. Raising cattle is really hard. It's something that I always admire people for because my job is hard, but when I think about caring for livestock day in and day out and the commitment that requires, that's a whole extra level of hard. And so I commend you for that. But I also think you need to stop and think about, why do you do it? And this is usually something you're contemplating right about the time you're working cattle, and you're like, literally, why do I do this? Because they're so frustrating sometimes. Um, but when you step back from it, what are your goals with your cattle herd and your operation? Is it tax purposes? Are you trying to help have a ag exemption because you've put a really nice house on a nice piece of property and don't want to see your neighbors, but you don't also want to pay property taxes that are that high? Is it philosophical? Like, this younger generation, they are doing things called homesteading, where they're wanting to raise their own meat and feed their families, not through a traditional means. Is it preserving your family's way of life because they've been doing it for generations and this is all you know and all you want to know? And it could just be as simple as you're trying to make an income, whether it be your primary or supplemental income, you're doing it for economic reasons. So, step one in a herd health plan is to define your goal for your herd, because it's going to be a driving factor in our decision making. My goal for today is more to give you a broad overview of a comprehensive approach to herd health. When I think about herd health plans, I kind of divide them into three basic categories in my head, and that's nutrition, disease and parasite management, and reproductive health. These categories they're independent of each other, but they also build on each other and the benefits that they offer to your herd. I listed them in a way that I prioritize them in my mind. So, level one or step one, the very basic thing is a good plan of nutrition and a trace mineral program. And then with that, you can build on that to then approach your diseases and threats to your herd and then your reproductive health. But when it comes back to it, if you don't have a good nutrition program, it doesn't matter how much money you spend on vaccines and bull testing, you're still going to see some deficits because they don't have the nutrients they need to have a functioning immune system or be as fertile as they should be. Another way you can look at these are levels of intensity of management. Um, Basic nutrition and mineral program is every cow, every time, no matter your level of input, you have to provide those things. Whereas as we move to the right, we move into more intense management systems. There are herds and operations that it either doesn't make sense or is not possible to accomplish yearly breeding soundness exams and preg checks, but that goes back into why it's important we know what our goals are for each operation so that we can say, this is the level of management I need to function at. So let's talk about a little bit about nutrition. I'm going to make a disclaimer that I am not a nutritionist, and most days probably not even as helpful as a good feed store owner or your local extension agent. But my main goal today is to make sure you understand some basic concepts and that just turning cattle out on pasture year round with no supplementation is not sufficient. So first, talking about total feed intake is important to understand that we typically talk about this as a percent of an animal's body weight, and this percentage can change based on their stage of production. And a stage of production is whether they're lactating, whether they're pregnant, whether it's a young growing animal. Is it a bull that's just in your bull battery and he's not working right now? He's taken his time of the year off. So the percentage of their body weight that they'll eat in a day will vary based on those factors. It will also vary based on the quality of the forage or feedstuffs that they're eating. So this first chart up here talks about dry matter intake as a percent of body weight. And the one that's horizontal, that TDN stands for total digestible nutrients. And you'll see as the percent of TDN increases, meaning that it's a more nutritious feedstuff, the percent of dry matter that they eat also goes up. So a cow who is eating dead native forage literally cannot consume enough of that forage to meet her basic nutrient requirements because she will eat a lower percentage of her body weight versus a cow that's eating nice spring green grass that has a higher nutrient content will eat more because it's more digestible and it goes through the rumen faster. So that's a basic concept that can kind of help you think of you can't feed your way out of bad grass. And then when we talk about crude protein specifically, this is something that even basic feed programs kind of focus on. Most native forages will not have the crude protein to meet cows' demands throughout the year. Requirements range from 7.5 to 15+% of body weight, depending on the stage of production. The 15 plus is when you get into growing animals like in a feedlot that you're trying to hit average daily gain amounts. But a dry cow will only be at 7.5% of crude protein needs. So those change throughout the year as well and throughout the stage of production. It's kind of why I like this supplemental decision guide over here on the right side of the screen. Is it simplifies how to work through these decisions um, in a pretty helpful way. And it just starts with, do you have enough forage or not? Is your pasture already ate down and you know that they physically don't have enough to eat, even if it was adequate forage? Or do you have grass in abundance? And then as you work through that, it works through, well, if I have brown or green grass, and mainly saying like, is it actively growing or is it stagnant grass at this point? And gives some supplementation recommendations. This is really simplified and is a helpful way to look through this flow chart and go to the feed store and say, I know approximately the level of crude protein I need to be looking at for the product I'm going to buy today. OSU, their extension agent, as in Oklahoma State University, they have a website that has a protein requirement article for like every stage and weight of beef cattle that exists. And it's really helpful, but I think it's a little bit too in depth for what we're talking about here today. If you're doing something that's more detailed, like a grow yard or a dairy or something like that, you could look into that. But for our purposes, it was a little bit too in depth, and we didn't need that. But they do have some really good material on their website. Salt and mineral programs, they're going to be more complicated than crude protein because it can be dependent on minerals in the soil or water in your area. But all cattle should have access to salt and mineral year round, or you're going to see decreases in production. So access to it may mean that you have loose mineral out or a lick block out, or it may be mixed into a supplemental feed you're having to feed in the winter. It can vary how it is available, and it doesn't always have to look the same depending on the time of year or what the cows are needing at that point, but they should have access to it year round. There have been numerous studies that have shown, and I have even seen this true in clients' herds that I've taken care of, but lack of appropriate mineral intake can lead to somewhere between 10 and 15% decrease in pregnancy rates, meaning that if you have 100 calves that are supposed to hit the ground, and you're not going to have 10 to 15 of those next year because you didn't put out mineral throughout the year, that's a big hit to your pocket in terms of getting your paycheck when you sell those calves. So it's really important that we focus on keeping that supplementation out, and giving multi-min injections twice a year is not sufficient. I do like the product multi-min, and I think it has some really unique uses, but that is not a sufficient replacement of having a trace mineral program year round. And even the CEO and head developer of that company would back me in that statement. So minerals are where a really good extension agent or feed store help will be worth their weight in gold, because there are hundreds of different brands, mixes, physical forms they come in, and they can really help you work through which of those is going to be best for your setup. Whether it's because you're only putting it out every so often, or you have more rain than some of our other places regionally. They're usually pretty helpful in saying this is probably going to provide the most consistent supplementation as possible for your herd. And then water, that's just an obvious one that we need to make sure, whether it's cold or hot, our cows have access to water all the time and as much as they can drink. Also pay attention to that your water is not stagnant and a source for diseases as well. Additional resources that I would use to look into these if you feel like you need help is the extension sites for either Texas A&M or Oklahoma State University. They both have some pretty helpful information. And then if you feel like that's still not helpful enough, you can contact your local veterinarian or extension agent in person and talk to them about it. Probably step one will be body condition scoring your cattle and making sure that they're hitting appropriate weights. And then we can talk about where the nutrition may be falling short. Vaccination protocols. So this is vaccination protocols, but really it's about diseases. It's not a completely comprehensive list of all the things you can vaccinate for. Depending on where you're located, there are other things regionally that are important as far as diseases go, but I'm going to try to keep this list to the basics because it could become overwhelming to look at. So I like to group these into 3 categories in my mind when I'm developing a vaccine protocol for a client because it helps me think about practically what do I need to make sure that I am guarding against in my herd. So you have reproductive diseases, respiratory diseases, and clostridial diseases that are your main threats. Reproductive diseases typically manifest as abortions, decreased calving rates, increased calving interval. They're not always super obvious clinical signs if you are not keeping accurate and detailed records. They also may or may not be relevant in your area, depending on where you're located. Vibrio may not be as prevalent as we used to think it is, and brucellosis is the same case. We're technically brucellosis free in the state of Texas, but we have pig herds that, feral hog herds that carry brucellosis, and so it is still a threat out there. All of the respiratory pathogens listed are considered part of the bovine respiratory disease complex, and they can present as discharge from the eyes or nose, coughing, or just dull-looking animals that go off feed due to high fevers. Most of these are viruses, but you'll also see Pasteurella and Mannheimia listed because they can get secondary bacterial infections that cause pneumonia as well. And then we have clostridial diseases, which have a super wide range of symptoms from sudden death to red urine, diarrhea. They're most commonly seen in younger animals, as mature cattle tend to develop a long-lasting immunity over time. But these are the ones that everybody knows as blackleg. So if somebody says, "Oh, I gave your calf a blackleg," or, they're talking about a 7 or 8-way vaccine. Most of the time, they're talking about a clostridial vaccine, but not every clostridial vaccine is made the same in terms of which strains that are included in it. So it is important, depending on where you're located and your production phase, that we look at the strains of Clostridium in the vaccine to choose. And so all of these nuances is the reason there is no one set vaccine protocol in terms of disease or specific products that I could recommend today. Every protocol should be developed with your herd as the sole focus, and considering not just the exposure they have, but the logistics of vaccine protocols and how many times are they going to have to come through the chute a year to accomplish this vaccine protocol. More is not always better. Sometimes we try to keep it pretty trim, but there are some basic things that most every herd should be vaccinated for when it comes to reproductive diseases and clostridial diseases. I also made this list knowing that I personally don't recommend vaccinating for everything that's listed on this list in front of you for every single one of my clients. I like to get to know them, get to know what they're doing and how they're doing it before I sit down and write them a vaccine protocol so that we can choose the best option for them. And also know that your vaccine protocols for calves or younger stock are going to be different than your vaccine protocols for your mature animals in your herd. Oh, parasites. Internal and external parasites are something that can cause huge production losses really fast and animal welfare issues when they go unregulated. I group them into inside the body and out because it's easier for me to think about like that, because it's also easier medication wise, they're divided like that and how they're treated. So the most common internal parasites that we talk about are worms that live in the GI system. They all have unique life cycles, but the consistent part to their life cycle is that they're going to be transmitted through a fecal oral route, meaning that the cow poops. In the poop is an egg, like you see in that picture. Those are strongyle eggs that were floated out of a cow's feces. And so those eggs get on the grass, and then the egg turns into larva. The cow eats the blade of grass with the larva on it and swallows it, and that's how it gets back in the GI system. Environmental temperature when they're outside the host and exposure to direct sunlight will impact how long those larval stages can survive outside of the body. This is also different for each parasite in their life cycle in terms of the amount of time they can survive, and will determine which parasites are either most common or that survive the longest, and therefore you're going to see the more problems with them based on your region or the season of the year. So some of these do better in a little bit cooler weather. Homunculus, everybody hears about in sheep and goats for sure. It's not as big of a problem in our cattle where I'm at. But in the hot, humid southeast, they see it a lot in cattle too, not just small ruminants. And so there are a little bit of differences between all those different species of worms, but it's just going to determine for your specific herd what threat you're going to have the most of. They're going to typically be treated in the same way, though. Your other factors that you need to consider is for internal parasite management is your stocking density and your piece of property. Does my piece of property have a tendency to stay really muddy? Like, is it in a low spot? Or is it really dry? And I'm probably not going to see as much of that. Do I plant wheat every year? And so therefore I plow the pasture 3 times before I plant it, and I have no parasites, and that's considered a fresh pasture every year. All those are factors that will play into how you manage internal parasites with a dewormer. Common clinical signs of a large parasite burden are weight loss, diarrhea, poor hair coat, and swelling under the jaw. And internal parasite medications are commonly referred to as wormers. I think that's not intuitive because you're actually deworming them, not giving them worms, and can be administered as either an injection, a pour-on, or a drench, which is given orally. Now you'll see down here at the bottom, I listed liver flukes because they are pretty geographically limited to places with river streams because of their life cycle. So their life cycle requires a certain species of snail be present for the parasite to go through. And because of that, they will be geographically limited to certain areas. Your local veterinarian should know whether liver flukes are a problem in your area. And this is an important question because when you go buy a typical dewormer, it's not going to kill liver flukes. So there are only 2 name brand dewormers I can think of off the top of my head that will also kill liver flukes in addition to all your internal GI parasites. So and they're a little bit more expensive, so people don't naturally just choose them for no reason. But your local veterinarian would definitely know whether that's an issue in your area. We don't see a whole lot of liver flukes out here because we're far enough west, we're pretty dry. Now, on to external parasites. External parasites are a little bit easier in my mind to wrap your mind around because you can see that they're a problem. You can see that your cows are covered with flies. You can see, like this cow in the picture, that they're having massive hair loss from lice or mites. And so when that problem is in front of you, it is easier to know that you need to address it versus internal parasites. We can't always see the effects of those until it's really bad. So, external parasites have to be treated with different chemicals than internal parasites. We kind of talked about that. They're more of like what we would truly think about as pesticides, like permethrins, organophosphates, and chemicals that are on the outside of the body. They're available in ear tags, pour-ons, or sprays that you can mix up. And there are also environmental treatments like bags that they can rub on or dusting and stuff. But management of them is just as important as the internal parasites. The go-to thought with external parasite medications is that you want to rotate that every year, every season, whereas your thought for internal parasite management is that you do not want to rotate your dewormer unless your dewormer stops working. So for internal parasites, we do not rotate. We stay with the same drug until that drug proves ineffective. And there are ways to know that with doing fecal testing on your cattle. And then with external parasites, we continue to rotate the type of chemical that we're using for control of them every year. Reproductive management. So this is I put this as a third level because in my mind it's the level that takes you to the next intensity or input point to optimize the resources you have available and hit the next level of efficiency in your herd. It's truly necessary, in my opinion, for producers that are looking to do this for income, whether it be primary or supplemental. If you're really wanting to be efficient and make money, you need to include some reproductive management in your herd. Bulls should be tested 30 to 60 days before you turn them out with your cows for breeding season. And that can be done either on the ranch or at a veterinary clinic. But we collect a semen sample and make sure that their semen is not only fertile, but that they're going to have a serving capacity that is equal to what you're expecting of them. So there are some standards that are developed by the Society of Therionology, which is all the repro vets that say this is what a bull needs to test to be considered fertile. Now, those standards are saying that he will achieve a 90% pregnancy rate in a 60-day breeding season on an appropriate number of cows for his age, which varies. The younger they are, they can't serve as many cows. But it is not saying that if your bull fails a BSE, he cannot breed a cow. It's saying that he is not fertile enough to be efficient to achieve your goals to make this economically feasible. The other thing that we do at this time is that we test them for trick, which is Trichomonas fetus, and make sure that they are not harboring that. Once a bull is infected with trick, they are carriers for the rest of their life. And you need to pull them out of your herd and slaughter them. And the state of Texas will make sure that you pull them out of your herd and slaughter them after they test positive. But it's really important that we do this testing because trick is one of the most economically devastating diseases to the cow-calf sector, and it is way underdiagnosed because it causes abortions early in pregnancy. And what happens is after the cow clears that infection, it takes somewhere between 3 and 4 months for her to completely clear it. She can typically rebreed. So she is bred, she aborts the baby and reabsorbs it. And then 3 or 4 months later, she can be rebred again and go on and have a normal calf. And so because of the early abortion, sometimes you don't ever see those cows have anything come out the back of them. They just reabsorb it. And it really commonly goes undiagnosed in herds that have year-round breeding or don't keep records because you never know she slipped that first pregnancy because she rebred and ends up having a calf. And then the bull spreads it to all the other cows. And so what we see with trick is that we'll have lower calving rates or increased calving intervals where they're having to slip a pregnancy and rebreed and then have a baby. And so it's really important to test for that because it does go undiagnosed a lot. And then the last thing we can do for our herds is pregnancy diagnosis. And that can be done either through palpation or ultrasound scanning by a veterinarian, or that can also be done with the blood test. You know, if you don't have a local veterinarian that can come out and preg check your cows, that's okay. There's a really easy way to learn to pull blood from the tail of a cow, and you can pull blood and send it to a public lab, and they can send you those results. And as long as she was 30 days pregnant at the time of the test, she'll be positive, and you can sort through your cattle that way. It's a pregnancy diagnosis is a huge benefit because you can cut down on the number of inefficient animals in your herd. If she's not carrying a calf to term and then raising that calf to weaning, that cow needs to go on to do her other job in life. And her other job in life is to make hamburger. And they don't need to hang around on your property when they're not doing their job. And so pregnancy diagnosis can help you find those animals faster instead of having to wait till calving season and realize she was never pregnant to begin with. And so that's another way also during drought or times of bad economic times. If you need to cut your herd down, pregnancy diagnosis is a really good way to do that and get rid of your inefficient animals first. Record keeping is kind of a soapbox for me because you can't manage what you don't understand, and accurate records will help keep you on track with that. So there's two parts to record keeping in my mind. There is the data collection portion, which is as many details as you can about anything that happens on your operation. It is very important that every animal has a unique ID number with their date of birth so that you can record the calves that they had, the calves that they weaned, the date they entered your herd, left your herd, any vaccines, dewormers, medications, illnesses, injuries, all of that can be assigned to a specific animal if she has an individual ID with her date of birth in your record book. And so all of that information can be gathered, and then you can look at that and do the second portion of record keeping, which is the more valuable portion, and say data analysis. How many calves are born every year? What is the weight of the calves when I take them to the sale? How long between calves is your calving interval? So if on average your calving interval is 500 days, it is taking way too long for your cows to rebreed, and you need to look at that. You want your calving interval to be as close to a year as physically possible. If it's less than that, even better. If you have a cow that breeds back fast and she's having a calf every 345 days, that's a cow to keep around, and that's a cow to keep every one of her female babies out of it. And then you can look at the average age of your cow herd as well to determine, is your cow herd getting old and you need to start keeping back replacements? Or is your average age 4.5? and you realize that you have cows falling out of your herd too young, like you're not able to keep your cow herd long enough to make money out of them. There are so many things that you can look at and data that you can sort through if you have the numbers. So make sure that you write it down. It can be in a notebook that lives in your pickup. It can be an Excel spreadsheet. There's all sorts of software now. Personally, my father uses CattleMax and he really likes it. But you can do it any way you want as long as you're doing it. And then the last essential thing to herd health and optimizing your production efficiency is you need to find a vet and you need to get a VCPR. And you need to do that before there's an emergency at 11 o'clock at night and your calf needs to be pulled because she's been trying to calve for 6 hours already. And I say that because one, there are less and less rural veterinarians that are available. And so it's going to be harder to find somebody that's willing to come out and work for you. And that's just a fact of where we're at right now. And, that's hard, but it is what it is. And so you don't want to wait till last minute to get a vet out and establish a valid client-patient relationship. And then the other thing about having a valid VCPR is that it allows you to pick up the phone and call your veterinarian who has been to your place and knows your herd and has developed your vaccine protocol for you. And you call them with a question, and they're going to be able to more intelligently and accurately answer that question for you on the phone. And it may even avoid you having to haul an animal into the veterinarian. My clients that have valid VCPRs and I'm well associated with their ranch and their operation and how it functions, there's a lot of time that we have a conversation and triage a case on the phone and decide whether it actually needs to come in and see me or not. And so it's an invaluable tool. My clients don't pay me to answer questions and to pick up the phone. They don't pay me to develop vaccine protocols. In my mind, that's part of me being their veterinarian and having a VCPR with them. If your vet does require you to, pay for vaccine protocols and all of that, that's their business. But in my mind, that's part of being an established client. And so get that done and out of the way before there's an emergency, because you want to have happy babies that make it through labor. You don't want to have a dead calf and a dead mama because nobody would pick up the phone in the middle of the night. Thank y'all. I hope it was helpful. I hope somebody, at least one person learned one thing today. I work in Albany, Texas, and we have a couple different clinics, like I said, but that's where I base out of. I live there with my husband and my son, and we're living the good life in a small town in Texas and wouldn't change it for the world. So if y'all have any questions, I'm happy to stick around for a little bit and answer as many as I can.
Well, thank you, Dr. Berry. Yes, at this time, if you have any questions, please submit them in the chat box or the Q&A box. And it does look like we have a couple already. So first one, you mentioned monitoring age of your herd. At what age do you tend to think of healthy cows as becoming too old to conceive and deliver?
So I think part of that has to do with what breed you are raising. If you're just doing a commercial cow that's crossed with a little bit of everything, then as long as that cow is conceiving and carrying that calf to calving and then raising her to weaning, she is not too old. I do think it's a good idea when you run your cows through the chute every year to look at their teeth, because you might decide that a cow that is considered broke mouth or has no teeth left, that it's time for her to go so that you don't risk her not being able to maintain weight. But I'm a big fan of keeping them as long as they're doing their job. And the reason I say that is because it's not till a cow is between 5 and 6 years old, depending on when she had her first calf, that she actually starts making you money. So the first 4 to 5 years of her life and the baby she has during that time frame are her trying to break even for the cost of you either purchasing her or raising her from a calf. And then any calf that she has the years after that, she's actually making you money. And so you want the average age of your cow herd to be a little bit older. That's good. That shows that these mamas have longevity and that they're doing their job well for years and years. But some people say 10 as a cutoff. I don't really have an age that's a cutoff. I do think past 8, they need to have their mouths checked every year. And then no matter what age she is, if she's not pregnant at preg check, she needs to go. Or if you don't preg check your cows, if she doesn't have a calf during calving season, she needs to go. She doesn't get a second chance.
Okay, next question. Do you see a tremendous benefit for MLV over killed? Do you feel it's safe to give FP variants of MLV for non-naive pregnant cows? Or maybe naive?
So there was a lot in that. I'll start with the what MLV and killed mean is they're talking about the viral vaccines for the respiratory and reproductive viruses. And MLV is a modified live virus. And then you can also buy killed products. From producing immunity in an immunity standpoint, the modified live products by far and away create a stronger immune response and more lasting immunity. The cautionary part to the modified live products is because they are a live virus that you're injecting. If the cow has never seen that before and she is pregnant, there is a small risk that she will abort her pregnancy. So if you have not set up from either heifers that you purchase having had a modified live vaccine, or if you're raising your own heifers, you gave them a modified live vaccine as babies and then continued it, you can't just come in one day and change to a modified live vaccine without some planning, which it can be done. That's not hard, but truly the product I think that I use the most in my cow herds is Cattle Master Gold from Zoetis, because it is a combination product. It's partially killed and partially modified live. Everything but the BVD virus is a modified live virus, and then they killed the BVD portion of that vaccine. And what they've done is between killing the BVD portion and then they modified the IBR virus strain in that vaccine, that there's no risk of an abortion even in a pregnant cow that's never seen that vaccine before. So it is safe for pregnant cattle. And it is my favorite vaccine to use on my cow herds because I get a step up from a killed product, but I have less of a risk from a modified live product. And so it's an in-between point, because a lot of my heifers are coming in to the mature cow herd program and they haven't seen a modified live virus before. So unless we're going to run those through separate and really do a lot of extra work in terms of logistics and people and running cattle through the chute extra time to get them up to date to a modified live program, then I use Cattle Master, and it's a really good product that I've been very happy with. I hope that answered the question. I kind of got off on a little bit of a tangent.
Okay, next question. You mentioned improving rumen efficiency. How do you recommend accomplishing this?
Can you say that again? I mentioned improving what?
Rumen efficiency, and how do you recommend accomplishing this?
Okay, so the level I am talking about improving it on is by making sure that your cattle are eating more digestible forages or supplemental feed. So dead, dry grass native forages tend to have a really high level of non-digestible fiber of it in it that sits in the rumen a long time and takes a really long time to break down. And some parts of it are never broken down. And then like a green lush grass or something like wheat that's grown even in the winter, not necessarily just summer forages, but something that's nice and green and growing, it has a lot of protein and energy in it that are highly digestible. And so they get broken down very quickly by the rumen and passed on through the GI tract to be absorbed. And because they're going through faster, that cow can turn around and eat more, therefore providing herself more of those nutrients within a given time frame.
Great. What is VSPR? And what is a valid VSPR?
A VCPR.
VCPR. Yes.
So that stands for valid client-patient relationship. So that means I can't just see your cows and I can't just see you. I've got to see, it's got to be me, you, and your cows all together establishing this. In the state of Texas, it means that I have been on your operation within the past 12 months to a point that I feel comfortable with the inner workings of your operation and the animals there. And so for some of my clients, we reestablish this every year during preg check. Checking cows as they're running through the chute, and they're sitting there telling me about how the last year's been, any problems they've had, questions or concerns they may have. For some people that don't do routine herd work, I go out once a year and I spend 30 minutes either looking around, driving around their place, talking about concerns they have, talking about their operation or management strategies. Some of those visits, they also want me to develop a vaccine protocol for them, which I'm happy to do after those conversations, because when establishing VCPR, I should know enough that I can write you a vaccine protocol for your set of cattle. But it's basically saying that I've been on your place. I've seen what you're doing. I know what your goal is and what you're trying to accomplish, and I feel comfortable with that. If a client brings me one cow that has lumpy jaw on a random day and brings it to the clinic, and I treat its lumpy jaw and it goes home, and 8 months later they call me for a bottle of penicillin, and we haven't spoken since, and that day we just talked about the one cow with lumpy jaw, I don't consider that a valid client-patient relationship for their whole herd, because I don't know anything about their herd. I know about the one animal that I saw in my clinic.
Okay. Are there new on-site pregnancy blood tests workable?
Can you repeat that question?
Are the new on-site pregnancy blood tests workable?
I've never used them, to be honest. So our clinic has a blood test machine, pregnancy blood test machine at the clinic. And so we just pull blood and send it back to the clinic and only, and they test them. I've never used the chute. You're saying there's one chute side that can be run. And I've never used those, so I'm uneducated about that. I apologize.
The next question, is the MLV that much better for passive transfer to calf?
Yes, so it's better for all forms of immunity, but the best thing you can do for passive transfer, like you're talking about increasing the colostrum and having lots of antibodies in that first milk that the calf gets, and then that being absorbed through their gut. The best thing you can do is booster your cow's vaccine during pregnancy. So when they are run through the chute at preg check, I know most of the reproductive and respiratory vaccines are labeled to give pre-breeding, because that is wanting to protect the pregnancy. They're wanting to make sure that that cow is protected so that she can get pregnant. But when I vaccinate her during her pregnancy, usually in the second trimester, I am vaccinating her to boost her antibodies so that she can pour all those antibodies into her colostrum. And so you never want to do that with a new vaccine and change it in the middle of a pregnancy. But with the vaccine that she's seen in years past, you're typically safe to do that.
We have a question here. What are your thoughts on using liquid feed?
Liquid feed. It's typically pretty inefficient, like a molasses liquid mix. That is something that I will also plead that I'm not the expert on, but when you look at what you're paying per pound of protein, anytime that I have had to dig into that for a producer, I have found that a liquid feed per, when you math it down to what you're paying per pound of crude protein in that feed, is much more expensive than um just sack like cubes or something like that. Now there's some liquid feeds with non-protein nitrogen in them that are using urea and stuff, and that's getting a little bit more complicated into the nutrition side than I'm gonna haul off and get into because I don't want to misspeak, but typically it's expensive per pound of protein.
If there's a lot of dead grass and forage still standing in the pasture, is it advisable to supplement with hay or just crude protein in a feed trough?
So a lot of people do stockpile forage and they supplement mainly protein. You will still have to supplement some level of energy. So stockpiled forage is, or just dormant forage in your pasture, is going to be mostly fiber. And in order to process protein, you do need some level of energy in your supplemental feed, but that may be a smaller percentage. So, like in the 40% crude protein cubes, they have a smaller energy level in them than the ones that are 20%. And so, you do need some energy with crude protein. You can't just feed straight crude protein and expect the rumen to digest it.
If switching to Cattle Master Gold, when do I vaccinate the cows and bulls?
Ooh, so that is a question I would need a lot more detail than just that statement to answer. It would depend on what you're switching from, what your breeding season is. Is it year round? Is it a defined breeding season? And what current stage of production your cattle are in? So that's something that I can answer, probably not through just that question, but you can shoot me an email. I'd be happy to ask you those questions and answer that for you, but it would not be something I would just give a blanket statement to.
I use a killed vaccine on my cattle. Am I safe vaccinating with it once per year or is twice more comprehensive?
Twice is more comprehensive. Those killed vaccines' duration of immunity isn't very long. And so I typically tell people if they're going to use a killed product, like Fire Shield is a really common one, to do it twice a year. That is personally, that's what my own dad does. His cow-calf operation at home, he has, it's not 365-day breeding season, but it's not real short defined breeding seasons either. And so he's always just opted to use a killed product twice a year, and that works for him logistically. And so we haven't changed that, but he also has a pretty low disease threat level in terms of they don't see neighbor cows too often.
Can you comment on preferred needle size for IM and SQ?
Yeah, so As far as the gauge of needle, in terms of how big around the needle is, I prefer 18 gauge for young stock and 16 gauge for mature cows and bulls. And then for a sub-Q injection, there is a 5/8 inch needle that I really like. I do find on a few bulls that are real thick hided in the neck, it's not quite long enough. You need a 3/4 inch for sub-Q injections. But that 5/8 inch one is really good about even if you go almost straight in with it, it is not long enough to get deep into your muscle and still stay in the sub-Q space. For any in the muscle injection, I prefer an 1.5 inch needle, even in younger animals, to make sure that we're getting deep in that muscle tissue where it can be absorbed, and it will also help keep them from getting as big as sores from it.
But for the sake of time, this will be our last question. Do you suggest using a protein mineral tub to supplement protein in the winter while cows are eating hay and add cubes every 3 days?
So, once again, I'm gonna put a disclaimer that I'm not a nutritionist here, but what I'm hearing is that you put tubs out all the time because you're only able to supplement or only choosing to supplement with cubes every 3 days or trying to stretch that longer. And you can do it that way. You can absolutely use tubs to expand the amount of time between putting cubes out if you're not at your operation every day, if it's somewhere that is not where you live. It's just more expensive to do so. There's nothing wrong with protein mineral tubs. It just costs more per pound of protein to feed it that way.
Very nice. Well, Dr. Berry, thank you so much for joining us today, and we want to thank everyone else who joined us. We hope everyone has a great afternoon, and we look forward to seeing you all on our next Ranching 101 webinar on February 18th. The topic is what cattle operation style is right for you. Enjoy your afternoon. Thanks.
Thank you all.